Sorry, I'm from Micah, Taka.
I'm Fadili.
Adili, yeah. How long have you been here for?
So I've been here for 7 days.
How long have you been on the street?
On the streets for I've been 18 months now.
Inclusive health partnerships is how we refer to the partnerships we need to address health inequality, and that over the years of working with people who are experiencing homelessness or children and families, Lotus Place, more and more we see that people are being excluded or ineligible or don't have the skills to navigate the health system as it is today.
Homelessness and health, there is so many interconnected needs for the person that it's never just one response. It's always a range of factors that we work. And I think having that range of skills across Micah is key. It's the no wrong door approach where people are able to access services and we can move them through whatever their needs might be. The health programs that we have in the Inclusive Health Partnerships cluster is the frequent presenter program. So people that might be presenting frequently to the emergency department can work with our teams, and we work across the 4 major hospitals in Brisbane. There's Home and Healthy, who works with complex mental health, Care Finders, who works with aged people or forgotten Australians that may be able to access aged care services. And then we have our outreach programs, which would be the outreach nursing team. We have a health van that works in public space, and the Inclusive Health and Wellness Hub.
I've been coming here for 2 years. They vaccinated for COVID-19, they gave me the influenza shot, they helped me with liver problems. You know, what more can you ask? You know, they've been so good to me. So, mate, there's no more they can do for me. You know, like, I couldn't ask for better. I wouldn't leave there. I said to them, the only way you're going to get rid of me from Common Grounds is in a body bag.
The health that the nurses have kind of been able to provide me is a health that I try and let it play into the lifestyle that I'm living.
Small.
A person's health issues is never their sole issue. There may be homelessness, there may be social factors, there may be reasons they're not able to access healthcare. And so I think we need to really respond in that integrated way, and whatever their needs are for that day, we sort of work with them in the way that is able to address their needs but bring them into healthcare as sort of the end goal.
Do you want to come with us to our van?
Yes, please.
And we'll open up the van and you can take your seat. Check if people need any health checkups, and then also link them in with the right services and see what we can do the best, offer them the best service we can.
So if I touch it, how much pain out of 10?
There's no pain, it's just soreness.
Soreness, okay.
Over the time we've seen that there are 3 things that are really important for people who have been living on the streets or are socially isolated, and that is that they have a sense of their own home within themselves, and they can't have that when they're chronically ill or they're very sick.
Other than magnesium, you don't take any medications? Okay, yeah.
We also link up with the department every day. We have a support worker from the Street to Home team, also an outreach nurse that comes out, and we can help you with getting your document ready for social housing.
Yes.
In the interim, we can try and find some crisis accommodation, obviously somewhere where you feel like it's safe and you can afford. It's important for me because I can see there's a need, and obviously we're in a stage where we're in a housing crisis, where there's not enough accommodation to accommodate a lot of people, and a lot of vulnerable people tend to come here and find that this is their safe place because you've got a lot of services that come out here and provide service. But it's also breaking down the barriers, you know, where we can also educate people in how the system works and how they can benefit from services like us.